here we go, with helping patients improve their own healthcare and be part of the healthcare team with talking to their physicians. So this was actually created from a grant we got with the Georgia Health Sciences Library Association. You guys are actually the first group that's not part of our focus group to get this. So you're amazing, but this was done in coordination with librarians from the Shepherd Center, Morehouse School of Medicine, and Mercer University School of Medicine. So when we actually did our focus group and our pilot, we had people, students and physicians and PAs from around the state. So first I'm going to have you guys watch this video just to give you, it's from the AMA, so American Medical Association. Hopefully you can hear it.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4, okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is. That's
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay. But hypertension doesn't mean the same to you.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
What are some things that stood out to you guys with what patients had to deal with or were concerned with during that video?
Direction.
Right, directions on the bottles, because sometimes they're just like the one lady said, like I just take 2 in the morning, and that should be good. What was something else?
The amount of trust they have in us, like you said I should take it, so I did take it.
Right, the amount of trust they're going to put in their healthcare providers. So you can see there's a lot of things where patients might not understand, but for whatever reason, they're scared to ask more questions. They might feel intimidated. It's any number of things where patients might not feel as comfortable coming to you and talking to you and asking questions that maybe as healthcare providers, you're just like, well, why wouldn't they? Like, I'm their healthcare provider. I'm here for them, to take care of them. Why wouldn't they be able to trust me for me to take care of them? So just some basic definitions. Literacy is really just the ability to read and write. So as we develop stuff for patients, it should be important that we put something on a level they can understand. Like the gentleman who thought hypertension, he's like, oh, like you're hyper. And it's just because he's not familiar with that medical terminology. It's stuff I think sometimes we take for granted, and that we're like, oh, well, that's just, everyone knows what hypertension is. But a lot of people may not. They may be familiar with the more lay terms. And then health literacy, it goes a step beyond just the ability to read and write, but it's the ability that they can get information, understand it, process it, communicate health information back to just for themselves to understand or back to their healthcare provider. And so it's just their basic understanding of health, that their own health and what they understand with it. So why does this matter? Why does health literacy matter to the general population? Other than just making themselves better, here are some of the stats that we can look at. It's just 1 in 6 U.S. adults read at an elementary level. So it's just basic or below basic. So you guys you're really intelligent, you have good education. So some of that may surprise you, like really, like that many people read at an elementary school level. And that's even if people graduated high school, they can still read at a lower level. Low literacy levels actually cost us a lot of money. So you can see that it costs like $106 to $235 billion each year because of low literacy levels. And it can be with how people get tests. They may not need to test. They could, instead of getting a second opinion for a surgery, they just go in and get it without seeing that it may not need to be done. I believe second opinions are always really good. When I've had to have surgeries, I've gotten them. And it doesn't mean you don't trust your doctor, but something that's that invasive, you want to make sure it's absolutely necessary. There's nothing else. 36% of U.S. adults have limited health literacy, so it means when they go to their healthcare provider, whether it's their doctor, their pharmacist, their PA, they don't really understand what's being told to them. 36% of people that could come to you as a patient don't understand what you're telling them, and that can lead to a lot of problems. And then 53% have intermediate health literacy, so they might understand some things. So if you tell them about high blood pressure and how that affects them, they understand that. But if you were to say hypertension and use other words, they might not really know what's going on. And then only 12% of adults have proficient skills to understand basic health information and complete common tasks, such as taking their pills that are prescribed to them. So what does this result in? When you see patients and you see all these numbers, why does that matter, and what does that really have to do with their health? How does this impact their health care? How does it impact the United States overall? Well, then they might know less about their health problems. They might not understand what's going on, what it means to them, how it could impact their life, their quality of life, and then could even lead to death if something happens. So like my father-in-law or ex-father-in-law had diabetes, and he just refused to take his medicine. He refused to eat how he was supposed to eat. He refused to exercise. And eventually he knew, he's like, oh yeah, I mean, you can die, but I'm old, like, it's coming anyway. But then it started being like, he would just snap at his wife. He started feeling really bad. He never wanted to do anything. He didn't want to interact with his grandkids. So that's when he started realizing, oh my God, this isn't just affecting me. Me not wanting to understand what my doctor's telling me and actually see how it affects me overall is really impacting my entire life. It's impacting my family. So it made a big difference to him once he understood that part of it, but just the doctor telling him wasn't enough. And then it can lead to more hospitalizations as well. So more people not following what they're told to do, whether it's more exercise, whether it's like taking their medicine or just when to take it and to take it properly. And so not doing that and not understanding it can actually result in their health going down and then them having to go to the hospital or be hospitalized. That leads to like higher healthcare costs, and not just for that patient. It's going to affect all of us who have, whether or not you have insurance, it's going to rise. Like our healthcare costs are going to rise. Our insurance can rise because we're seeing more people going to the hospital. So then it's going to cost more money, and then it kind of impacts everyone. It's kind of like with the flu. It's not just about you and making sure that you get your shot so you're better. It's about making sure that it protects all of us. So making sure that your patients actually understand what's being told to them and that you communicate in a way they understand, because it's not just on the patient, it's on you as a healthcare provider to make sure they understand what they're being told, can actually help with all of that. And it makes everything better for everyone, not just a single person. And then, like I said, their health can get lower, so they can have poor health status as well. So there actually is a national action plan to improve health literacy. It was in 2012, and so the action plan hasn't necessarily changed, but aspects of it and supplementary things have. But they even state, like, limited health literacy is a major problem to us, to public health, to all of us, because it can have all of these impacts on what people are doing. So it could mean, I'm from a rural area, so I'll use that as an example. People there may not have as many physicians to go to. We had one doctor in town, and I didn't go to him. I had to go, like my parents had to take me about an hour and a half somewhere to go to another doctor to see them. And that was just it. It was a doctor. He had a couple of nurses, but there weren't any other kind of people to help. We had one pharmacist in town. That was it. And we were lucky to have that. A lot of places in rural America might not even have that. But then it can impact people to where if they don't have that, or they don't have other people to talk to, or they don't go to someone, then it affects them. It affects what they're going to do. So that might be seen more in like rural areas than places here where we have so many options to go to and so many people to talk to. But whether it doesn't matter the number if you're not comfortable in talking. And then sometimes admitting your own ignorance, that's hard. I don't know about you guys, but I'm like, I don't like admitting when I don't know something. I want to be like, oh, I understand that. But even going to a doctor, it took years for me to be comfortable to ask them questions and to make sure I understood what was going on instead of just going, oh, it's a doctor, oh, it's a PA, it's an MP, they know what they're talking about. I'll just listen to them and not ask questions. But improving health literacy, it really does start with you when you get out there, even when you're on rotations, when you begin that, either if you're already on them, if you're a pharmacy student, or you're about to be on them, but if you're a PA or a DO, it's going to start with you. It's going to start with how you communicate with your patient and how you give them information so they can actually become part of the healthcare team and actually invested in improving their health because they understand what's going on and what that means. So some of the at-risk populations, as you go into different rotations, you're going to see different populations out there. You may go to specific kind of practices that have some of these, but the elderly, so those over the age of 65 sometimes just, again, do what their doctor tells them. They don't question it, or they think they understand it. Like the gentleman was like, oh, well, hypertension, like it means I'm hyper, so I understand this. But he didn't really, and he didn't question it. People with limited education, people with low income, non-native English speakers, then racial and ethnic groups other than white, because it goes into socioeconomic status as well. Refugees and immigrants, and then adults with disabilities or illness. So these are the populations that are going to be affected. And you've probably seen or you know that sometimes there's not help for them, or sometimes there isn't someone who can understand what they're going to relate to them. And that's, again, even where empathy comes in from you and actually being willing to listen to your patient and understand their preferences and take that into how you're treating them. Because, of course, you are very knowledgeable and your clinical expertise will be on point, but you're also going to have to take into account what the patient wants, what their preferences are when you're doing that. And so that, along with any kind of limited health literacy, could really impact them negatively if you're not taking all of that into consideration. So patient-centered care really is important. So what are some of the ways that you can see if a patient may have low health literacy or may not understand what you're saying? They might just not get it and they're just too ashamed or scared to ask. They could frequently miss their appointments. And some of this may not even be because of limited health literacy. Again, it could be socioeconomic status. It could be they don't have a car to get there. There's no way for them to get to the doctor. They could have incomplete registration forms, either because they don't know what to fill out or they think they filled out everything that's applicable. One of the things, I'll be honest, that gets me every time is, you just scanned my insurance card. Why do I have to put this information on this form too? I do it anyway, but some people might just go, I don't need to do that because they've already done it. You know what, I had a surgery back when I was 17. I don't need to put that on this form. And they just might not do it because they don't think it needs to be. It's not important. So they could have it for that, or they could just really not understand what the form is asking them. They wouldn't be able to name medications or explain the purpose of it or the dosing. So that's on like forms when they come in too. What medications are you currently taking? It may ask the dose. And they might not be able to name them. And so that's part of it with like medication reconciliation, being able to have all of that and go to a doctor or pharmacist so they can look at all of that, tell them, you know, oh, some of this is overlapping, you might not want to do it. But if they don't remember that and can put it on that form, you as the doctor may not know that they're taking more than one thing. The pharmacist may not know. What if the patient has 2 different doctors for 2 different things and they haven't checked to see what it is? Well, then when they go fill it, if it's at the same pharmacy, it'll be you as a pharmacist who needs to look at that and go, oh, let me call your doctors to see what's going on. Because the patient, they might not understand that 2 medications may have an interaction. And so again, it's up to you guys to be able to do that and to help them understand. And when you're questioning about their medication, just say, oh, well, you have nothing on here. Are you sure you aren't taking anything? Or do you take it for, you know, we talked about your high blood pressures at that. Because if you say, oh, do you take something for hypertension? No. Whereas if you could have just changed it to high blood pressure, they could have been like, oh yeah, I do take something for that. It was actually my primary care physician instead of you as my, I guess, orthopedic doctor or something could do that. They can identify pills by looking at them, but they're not reading the label. So that could be something where they're not really reading the label because they can't understand it. Or they may have put everything into one of those little containers. So they're just like, oh, this was a white capsule with black writing. Yeah, I'm supposed to take that today. Where maybe it got mixed up. So they're just doing that, and they're not really reading what to do, or they don't understand what that label is telling them. Again, as we saw in the video, someone was like, well, it says take twice a day, but I mean, morning or night? Do I take it at breakfast and dinner? Do I take it at lunch? Can I just take 2 at the same time? And unless that's specifically spelled out for them, they're really not going to understand that. Because even for me, I'm like, oh, twice a day. Like, I'm just thinking, okay, I'll take it in the morning and in the evening. I'll just do that. But even for me, I can't say specifically when I'm supposed to take that. So if you think about that, where I do have a higher literacy level, I think I have a higher health literacy level, what about people who don't, and what are they going to do? So if I'm still just like, I can't tell you exactly what that means, what is someone who has low literacy and low health literacy going to think and do? And then they'll ask fewer questions, again, because they don't know they need to ask questions. They don't know what to ask. They don't know how to ask it. They could be like, well, what if I don't use the right words? So again, you just helping them feel comfortable in that situation will help them open up and share with you their questions. And there may just be some time where you just sit down and talk to them. So instead of just standing and doing it, pulling up that little round chair next to the patient and being like, let's have a conversation. Let's talk about this. And really being able to make them comfortable so they don't feel like intimidated with someone like an authority over them saying, oh, we're going to do this. This is what we're going to do. This is how we're going to do it. And feel like it's a demand. Make it just sound more like a conversation where you highly recommend it, and hopefully they'll listen. But even for people, it could be stubbornness. I don't like being told what to do all the time. So someone's like, you're going to do this and you're going to do this. I'm kind of like, maybe I'm not going to do that. So it's up to you. Like, I mean, that's just how people are sometimes. So you're going, I really think this would help you. Here's how it's going to help you. Here's why it's going to help you. And then that can just help the patient feel more comfortable. So if it's, if I'm just like, no, you're going to eat this veggie pizza and that's what you got. Whereas it's like, oh no, there's options for this. Here are options that we can do for your health care and what you can do. And then you're kind of like, okay. I'm like, well, I recommend the veggie pizza. Here's why. Here's how I think it could benefit you. And then you're like, okay, I think I'm going to try this veggie pizza. I'm going to do this. So it's just making it a more comfortable conversation for the patient can really do that. And the other thing you want to do is avoid stereotypes. So limited health literacy has affected most of us at some point in our lives, whether when we were younger, when we're teenagers, in our 20s, 30s, and above. So you need to use clear communication with all patients. Don't just think, oh, this person has a heavy Southern accent. I just need to talk a little slower use small words. Like, I'm just saying that because, you know, I have a Southern accent, so I'll use that as the example. But it may be that that person is brilliant in one of the top 5 geniuses in the world, and you're judging based on accent, or you're judging them by the way they look, or you're judging them based on where they're from. And it's not appropriate, first of all, but it's also going to make it to where you're not communicating clearly to the patient, and you're already putting this judgment on them. And that is definitely something no patient needs. No one needs that, really. But especially a patient who's coming to you as a trusted healthcare professional doesn't need that. And it's not going to make it to where they feel comfortable to be able to ask questions about what you're telling them to do. So, respect your patient. Again, just like I'm here for students, I'm here for you guys and faculty. I'm here for faculty too, so I'm everyone. But it's like, if you guys didn't attend this school, the faculty and I, we would not be here. So this is about you. This needs to be student-centered. We need to care about you. So when you become a doctor, take the loving care that we have given you as students at PCOM and transfer that to your patients and focus on the patient, respect them, and make what you do about the patient. Of course, take all your clinical knowledge, everything you've learned, what you're seeing in the literature, changes to guidelines, use that and your care for the patient to be able to treat them. So listen to them, be patient with them. I think part of the hardest problem going to a doctor is feeling rushed. Because, you know, as doctors and pharmacists, like, you got stuff to do. You have things you need to get on. But as a patient, sometimes I might have questions where I'm asking for a little more. So just be patient with the patient. So, you know, just stay with them and try to understand them so that they feel like you actually care about them and there's not a paycheck for you and you're trying to get them in and out and get it done. So be patient with them and talk openly about the diagnosis and treatment. Be honest with them. I mean, don't terrify them, but be honest with them about what's going on with them and treatment options. It's not always just take this. Again, for me, I can't swallow pills. It's not going to happen. It's just not. Unless they're very, very teeny tiny. So when the doctor's always just like, oh, I'm prescribing this, I'm always like, can I crush it? Can I chew it? Can I cut it in half? Is there an alternative of a powder or a liquid? And so then they talk to me about the options that I can do, or sometimes they may be like, oh, we can give you a shot then. Which then there's a whole needle thing with me, but you know. Then I just close my eyes and don't look at it. But you know, just be able to talk openly about them, what's going on, and honestly, and be able to put it in words that they understand and kind of break it down for them. Because you never know their story, you never know really what their literacy level is, their ability to understand health information, what they've been through that day. I mean, that's another thing. Sometimes just navigating hospitals itself, if you work in those, can be a nightmare, even if you work there. So imagine a patient who's already just feeling bad, could be nervous about tests being done, walking in there and going, okay, now I got to navigate this. Was it the second or the third floor? Which door do I go into? Now I have to fill out these papers. Now I have to tell, the nurse this. I'm waiting in the waiting room forever. Now I talk to the doctor. I'm just so confused. I don't know what to do. So there's all of this that goes to the patient's mind as they're doing that, to where you just give them their options, listen to them, be kind, be patient, and be honest. Don't try to hide anything because you're scared of hurting, making them scared. Be honest with them about what's going on, what you can do to help, and what they can do to help themselves. Because again, it's going to take that patient being engaged in their health care to make a difference. It sometimes won't matter what you do if they're not listening to what you're saying, if they're not making sure to take the medication properly, if they're not making sure they're eating right, exercising, whatever you've recommended. And then let them know about potential problems. That's the one side effects of medication, because they exist, right? That long, like, at the end of commercials, where I'm like, what was that? Did they say death? Like, what did they just say? So you have to know that. So let them know about potential problems. Like, I'm going to recommend this to you, but it could cause gastrointestinal issues. So just bear in mind that as you're taking the medicine. And let them know what could happen, and especially if they're doing surgery. Be honest with them about the pitfalls of that, if there are any. Say, these are things that can happen, but we believe the benefits outweigh the risks, and you will feel so much better, and your quality of life will be better when you've had this done. Like I mentioned earlier, their values and beliefs and those of their families. It could be that they want somebody in the room with them, or they think somebody needs to be in the room with them, or it could be, you know what, I only want to see female doctors. It's just my belief. It's what I need to do. And sometimes that'll happen. I mean, there could even be people who are just like, you're a PA and you're magnificent, but I want to see a doctor. And I mean, that will happen out there. But you just need to respect that. You can explain to them, you know, well, no, I'm the same, or for you guys, if you're going to be DOs, they'd be like, well, I want to see an MD. And it's like, well, here's what we do, you know, and we actually get more training than they do. So, you know, we're amazing. But just, you still have to respect the patient and what they believe, because if they're not comfortable, then they're not going to be honest and they're not going to be open. So again, look at their values, their beliefs, and their perspective just on things, what they see and how they see it. So it could be that they're just like, well, I don't believe in taking this kind of medication. Or it could be, you know, I'm vegan, this medication was tested on animals, or it has animal stuff in it, or whatever. You need to take that into account and think of their perspective and what that means to them, and be able to help them as much as you can. And of course, this can avoid malpractice lawsuits. We want to avoid that at all costs, right? But going through this and respecting your patients and explaining things to them clearly can help avoid this. In some cases, it could be if they don't understand it and they just signed something, but they didn't understand what they signed, and you do something anyway, that could come back and there could be like, you know, a lawyer saying, my client signed this and you didn't clearly explain to them, and where's this documentation, and you know that they can't read, they just had to sign with an X. Like, all of that you can help avoid by just respecting your patient, speaking to them in a way they understand, and making sure they understand what you're actually saying to them. So there is a health screening tool. So hold on, I'm going to try to make it to where you can see it a little bit better, maybe. So this is like a pocket one we print and just have for people laminated. But when you're doing stuff, this is something to think of with patients. So these are questions you can ask the patient to see if they understand. So how often does somebody help you read your hospital materials? I don't know if you guys have had surgery or if you've had children that have had surgery, but I just remember my daughter and my son had both had surgery, and when I left, they're just like, oh, here, read this. It tells you everything you need to know. And then I'm like, okay. Except I didn't just say, okay. I was like, wait, I have questions. Hold on. This is my 1-year-old. I need to know this. But it said, like, you know, here's what you need to do or look out for when you get home. Here's, you know, make sure they don't eat after this long, or, you know, a follow-up will be this point. But it's all in there, and it was like this packet of paper, and it's just like, you know, I'd like to have a conversation about this. This is a lot to read. Like, what are the highlights? Just give me the high points on this of what I need to know to make sure my child's okay and I don't make this worse. So they do that, so you can say, here's the scale, always, often, sometimes, occasionally, or never. And then how often do you have problems learning about your medical condition because of difficulty understanding the written information? Again, even when I worked at a hospital, we had patient education handouts we could print and give to them, but it's like, you know, were they really written at the appropriate level? And that's sometimes harder to determine. If you have a higher reading level, so if you have a 12th grade reading level, and you're like, okay, is this a 5th grade level? Like, it seems like it is to me. Yeah, they should be able to read and understand this, but they may not be able to. So again, it's a question to ask the patient, and then they kind of score it really quickly. And then how often do you have a problem understanding what is told to you about your medical condition? So not just what's written, but it's what the healthcare provider told you. And then patients can answer that. And then how comfortable are you filling out medical forms? And so once they do that, it can give you an idea of what their skill level is when it comes to health literacy. And then it can help you. You don't have to do this, but it's just one thing you can do to talk to your patient and be like, I want to make sure I'm giving you information that you understand that can help you. So if you could just answer these, that would really help me be able to get you what you need to know about your health, your medical condition, the surgery you're going to have, whatever the case may be. And here's a description of it as well. But this is something that can, again, help you help your patients when you have them. Right now you don't, but you will. So let me go back in here. So then clear communication. Again, in addition to being respectful of your patient and being patient with them, you can slow down what you're saying. You can limit the information you're given, so put it in very easily understandable chunks, and repeat it if you need to. Repeat it at every visit, especially if there's something that's kind of a chronic condition, or it's going to be long-term medication for them, you can repeat the information. It's okay. Like repetition is a good thing, as you know from studying. All of you do that a lot. Avoid medical jargon. So again, the example of hypertension versus high blood pressure. And then use illustrations. So that's something that's becoming more prominent, is having images. I wish I had an example with me, but having images to help patient understand what's going on. We're seeing them on pill bottles now, where they might have that. They might have different colors they use to draw attention to specific parts of the directions of their medication. There's stuff in the hospital, so in doctor's office, where it's like, if you stop smoking, here's how it can help. But sometimes they have images of that. This is what your arteries will look at. This is what your lungs will look like, a week after, a year after, 10 years after. So being able to see that makes a huge difference. Again, like telling a story, this is always marketing. So Barbara always says this, like, there's a story to it. Don't just give information. Like, people don't care about information sometimes. They want a story with it, because the story is what matter, and it connects people. So them seeing like, oh my gosh, my lungs could look like that. My arteries could look like that if I keep eating like McDonald's every day. Oh my goodness, it's awful. And then easy to read materials. So I don't know how many of you have heard of Medline Plus, but it's something from the National Library of Medicine, and it's meant for patients. So it can tell them in easy to read information, and it is available in different languages as well, namely like English and Spanish are the main ones. But it's on there and it's intended for the patient, but it also links to other places that can help them. So it might link to the American Heart Association and their section for patients and their information for patients on specific conditions. So that's somewhere that if you need to go, you can recommend patients to go when you start seeing them, and it's somewhere they can go to do a little research on their own. And then these last two, so make the visits interactive, ask me 3, I'll go over that in a minute, and then the teach back method as well. So there are 2 methods you can use to be able to get information from patients and make sure they actually understand what you're saying. So you've already done all of this because you guys are amazing pharmacists, doctors, PAs, all of that. You are fabulous. So you've done this and you've got it down, but you still need to make sure your patient understands. You've followed everything you need to. So then you will do those ask me 3 and teach back to be able to know they understand it, and not just them going and nodding their head. So when you're writing, so this is another thing, when you're writing stuff for your patient, think about who you're writing for. Use short sentences. Again, careful with that jargon. They might not understand it, so put it kind of in plain language. Use active voice, not passive. I am not good at that. If any of you need help, see Megan Dorito. She is right here. She is the guru, she and Erica, with writing, but passive voice is Megan's thing. She can help you if you need it. Don't underline stuff, and use lowercase, if you need to, bold for emphasis, and don't use block capitals. So for me, I don't know if you guys sometimes see the emails that come out. They're like, let's put 80 colors and 5 different fonts in here. What am I supposed to pay attention to in this email? I have no idea. So when you're writing stuff for patients, make sure if you're going to draw emphasis to anything, you are selective with it. And then put complex information in bullet points. So the things that might be harder for them to understand, make them stand out, make them stand apart, and put it in there to where they can make it digesting that information a little bit easier. Again, everyday words, talk to them, make it a conversation so that they feel more comfortable with you. Write out your small numbers and use the personal touch. Bedside manner. I know most of you guys that because I see y'all in the library sometimes, and you can be very nice. So use that bedside manner. Y'all got it, and you know it. So ask me 3. So this is something for the patients. So, ask the, like, what's your main problem? What is that? Or have the patient ask you that. So this is something patients can use. So the patients will go to the doctor, what's my main problem? What do I need to do? And why is it important to me to do it? So what's the issue? So I know what's wrong with me. So again, hypertension, high blood pressure. What do I need to do? You need to exercise, change what you're eating, and this medicine will help you in the meantime. Hopefully we'll get it low enough, maybe you can get off this one day. And then why is it important to me? Again, the patient cares, it's patient-centered. You gotta find stuff that matters to them. It's not just about if it's gonna help the disease. The patient doesn't care about that. You might care about that, but the patient cares about how it's gonna improve their life. So why is it important for them to do this? And put that personal touch on it. You know what? You're not going to be able to play with your grandkids. You're not going to be able to attend your daughter's wedding if you don't get straight and get this under control. I mean, you might not want to be that, but I'm very blunt. I'm just going to say it. So I'd be like, look, you need to do this because it's going to matter not just to you, but to other people. But you can say, hey, this is going to help to when your family goes to the beach in the summer, you're going to be able to get out there with them and to play and to enjoy the beach and to go swimming with them. It'll be great. So tell them why it's important to them and make it matter to them. Otherwise, it's again like, well, I don't care. Like, I still get to sit home and watch TV. Why do I care? So those are questions the patients can ask. But if they don't, maybe it's something you can break it down for them. So if patients don't ask that and they don't know to, you could say, okay, here's your main problem. Here's what you need to do. Here's why it's important to you. So you can flip the script so you're still helping them. So the teach-back method, why would we want to use this, first of all? So 40 to 80% of medical information that you guys tell patients, they forget immediately. As soon as they leave that room, it is gone. And then even if they retain the information, nearly half of what they remember incorrectly. So this is like, oh, that's really not good. Like they don't really know what's going on. Like even though I told it to them, they don't remember it or they remember it incorrectly. So that means that they're going to end up, mishearing and not being able to comply because they heard it incorrectly. So the teach-back method is when you ask the patient, okay, repeat back to me or explain to me in your own words what I said the problem is, what you need to do, so that then they know what's going on, they understand it, and they can actually tell it back to you. But make sure you use open-ended questions. You don't want something that's like, do you understand what I told you? Yes. Do you have any questions? No. Because again, that just goes back into that loop of them not understanding and not being able to improve their own health and not being active in improving their health. So make them know that the responsibility to explain it clearly is on you, not them, right? It's the same with your faculty. The onus for explaining what you guys need to understand is on the faculty. They need to explain it clearly so that you know what's going on, right? Y'all giggling, but y'all know what I'm talking about. So if the patient can't tell you back what you need to do and they're just like, oh, I can't remember if you said like I need to, I need to make sure I exercise 3 times a week, or was it just, 3 times so I can take a walk in the morning, at lunch, and in the evening, and I'm fine? Like, what is it? Then you can go, okay, let me explain again, and you talk again. Okay, so can you, say back to me what I just told you? Just explain it in your own words, just so I want to make sure I explained it clearly. Anything you give them, make sure it is easy to read and it supports what you're trying to do, and it's written on a level they understand, again, in plain language. And then document that you did this with the patient and then what the patient said. So make sure you do that. And if the patient needs to write it down or you need to provide notes, do that as well. It's fine for them to leave the doctor's office with notes, right? Every time I take my kids for checkups, I always come back with, here's what an 8-year-old should be doing. Here's what they need. Here are the shots, which that flu shot did not go well. It kind of sprung it on them both. It didn't go well. So we have some activities to do now, but I know some of you have class that you're going to have to get to. So if you do need to leave, I will not be offended, but we're just going to do a few activities to see what it's like for patients to handle stuff. But I know some people might have, I know sometimes pharmacy students have quizzes at 12:45, so just putting that out there for you guys. So you can do that if you need to, because I know it's there. But we'll still be recording, so you guys can watch this part later to see what the active learning is, but I know some of you need to get to class. Okay, everyone, so this information, it's on your handout as well. What I want you guys to look at, so sometimes patients, and I'm just using this as an example, but you're telling patients they can or can't eat certain things, or it's recommended that they don't eat certain things. So how easy or hard is it for patients to be able to understand, reading this label, what they need to do? So it's kind of hard to read, but here's that label printed out for you, and then we have questions. These questions on the next slide, those have the answers on it. I don't want to show you that. Go back, go back, go back. Don't look at those answers. So it's on here. So this is something you could give patients to see if they understand, or just ask them a couple of things just to make sure they understand it if you're trying to help them with their food and with what they're doing. So see if you can answer these questions here, and then what we'll do is we'll look at, if patients ever do this, then you'll just see, was it answered correctly or not? And then that's what you'll do, and you'll use information from that to be able to say, okay, they need help. Like, they really can't, they can't understand how to read this. So what I want you guys to do is take about 5 minutes just to answer some of these questions, work together, have fun, it's great, just to see what is there and what it's like for a patient when you actually tell them something that seems as simple as, okay, here, just make sure you eat less saturated fats, have less carbs, we want to increase protein, whatever it is, how it can be for them to have to take all of that in and actually be able to apply it when they're looking, they're at the grocery store wondering what they can or can't do. This one's actually an ice cream label, so make it something that, people generally like as ice cream. So I'll just give you guys a few minutes for that, and then we'll go over it. Okay, so we're going to go over this to see if you guys got it correctly. And if you didn't, don't feel bad. I'm sure you all will. But it just, hopefully this activity gave you guys a little insight into how it could be for a patient when they're trying to understand this. And it won't just be one thing. It'll be everything they eat if this is a recommendation you give them to change how and what they're eating. So for the first one, 1,000 is the answer. For the second one, there can be a few different ways to word it. You could say 1 cup, any amount up to a cup, half the container, 2 servings. But if they say something like for 2 servings, you could say, well, how would you measure that? How much is that? Because I know when I'm like, maybe if I'm drinking soda and I'm just like, oh, this is good. And it's like, oh, yeah, it's only like, I do Coke Zero because it's 0 calories, and there's not just saying, there could be all these other ingredients in there that are worse for me than the calories, right? But if it's on there and you're just like, oh, 180 calories, that's it, yes. But then if you're up on closer inspection, you're like, oh my gosh, that was 2 servings. So that was actually like a lot more calories than I thought it was. Oops. So, if sometimes we do that, what are patients, doing who might have limited health literacy? So it'd be best to say, okay, well, how much is 2 servings? And to ask them, a little more clarification on that. For number 3, so they want you to reduce the amount of saturated fat in your diet. You can have up to 42 grams. 1 serving of ice cream. But if you stop eating ice cream, how many grams of saturated fat would you be consuming each day? And so this is 33 is the answer for that. So you're just subtracting. There's 9 grams of saturated fat. If you stop eating it, then you'll have 33 instead of 42. For number 4, so you usually have 2,500 calories a day. What percentage of your daily value of calories you'll be eating if you have 1 serving of ice cream? In this case, it is 10%. And then pretend that you are, I don't know if I can move this thing without messing stuff up. Okay. So if you were allergic to penicillin, peanuts, latex gloves, and bee stings, and you wanted to know if you could have this ice cream, hopefully there's not going to be any bees that fly out and sting you, but would this ice cream be safe to eat? The answer is no. So you could ask the patient, well, why not? If they actually answer no. And then it's because it has peanut oil in it, and that's in the list of, there we go. So it's in the list of the ingredients down here, it has peanut oil. So these are things that, this was just one for you, but imagine if you're telling this to a patient and they're having to upend their entire diet, so they're having to look at all of this. It can be a bit overwhelming, and it can be hard to do, especially if they have low literacy, low health literacy, maybe math is a bit difficult for them. So there's all these things that go into changing their diet other than just changing their diet. So it's just something to keep in mind when we're doing stuff with patients. So for this, we see this prescription label. Take 1 tablet on an empty stomach 1 hour before a meal or 2 to 3 hours after a meal unless otherwise directed. So the patient forgot to take medicine before lunch at 12. So what is the earliest time he can eat in the afternoon? If he ate at 12, what's the earliest he can eat? 2, right. So, that was fairly quick for you guys to do, but would it be that quick for a patient? Would they understand this? They're just like, okay, 2 to 3 is after a meal. Does it matter what meal that I do this at? Does it matter what time I'm taking this? I don't really know. Like, what am I supposed to do? So it can be difficult. So this is the last thing we're doing. So say that this is, you give the patient a handout, and it has this on there. The Dietary Guidelines for Americans recommends half an hour or more moderate physical activity on most days, preferably every day. The activity can include brisk walking, calisthenics, home care, gardening, moderate sports, exercise, and dancing. That's a lot to take in. We can simplify this, right? So what I'd like you guys to do for just a couple of minutes, try to simplify this and make it to where it's something that you can say to a patient really easily, that they could easily say back to you. So put it in just a couple of chunks and see if, give you a couple of minutes and see what you can do to make this kind of a plain language summary for the patient. Okay, so what are some of the answers you guys have for this? How can you make this a little more plain? Nope, Dr. A, don't point at her. You're the one saying it. Come on, speak up. Get with it. Get with it. It's plain and to the point. Get with it.
30 minutes a day of your heart beating faster, and any type of movement that just gets your heart beating faster than normal.
Okay, so 30 minutes of exercising a day that gets your heart beating faster than normal. So I think most people would probably understand that if you're telling that to them. Like, okay. Like for me, it's like, God, walking from this building to the next when I have to teach and I'm speed walking. I need to do 30 minutes of that just between the buildings, like pretend I'm late to something, right? Anybody else? No? Okay, because you could say maybe do at least 30 minutes of exercise, like brisk walking most days of the week. Right, so something like that. So like what you said, get with it. I like that. Get with it, get moving. Dance, have fun. So those are good. So takeaways from this. Remember to listen to your patient. Use plain language. Use that teach bath method. Make sure the patient can actually talk, like say back to you what they're supposed to do, because that will show understanding. So out of everything I kind of like gave you guys today, these are 3 things that matter. Because if you're listening to your patient, you're respecting them, you're taking in their perspectives. So it's not just listening as hearing, but listening as in taking it in and actually actively listening. Maybe I should change that to actively listen to your patient. And then make sure you're speaking in plain language and use that teach back method. Those are like 3 of the takeaways from today. If you do nothing else, if you do these 3, it can really improve what you're doing with your patient and how they perceive you as their provider, and then how they move forward with their own health care. Here are a bunch of references. So some of these are references where we use to create this, and other ones have like toolkits and other things that might be good for you guys if you want to look at it and review it. So just references that we've used and references we think could be useful to everyone. We're in here. Oh, okay. And pharmacy is about to start. So we are done. If you guys have any questions, just because we're short on time, please email me and let me know. Stop by the library, and then if there's any classes you would like to see, let us know.